The world of robotics in surgery has jumped forward and advanced so much over the last several years. We decided to come over here to Singing River Hospital and talk to a couple of the doctors, a couple of the OBGYNs, Dr. Bosco, Dr. Delgado. And first we're going to start with Dr. Bosco. How are you, sir?
Good, thanks for coming.
Well, thank you very much for having us here. And I mean, we've been here before. We've talked about the Da Vinci unit, but there's so many new things that all the time that you're using this in doing surgeries. And one of them, as a OBGYN, are hysterectomies.
Right. So hysterectomy is still one of the most common procedures done in the United States. Here at Singing River, since 2008, we've been using the Da Vinci platform to do minimally invasive surgery with small laparoscopic incisions. The traditional platform involved 3 arms. We had a camera arm and 2 operating arms so that the patient had 3 small laparoscopic incisions instead of the traditional big incision.
Mm-hmm. And of course, when it comes to the cosmetic thing, the women, I'm sure, like that a lot better.
Much better. Recovery, return to work was all improved.
That was going to be my next question. The recovery time, that has improved immensely as well, because used to, what, a couple weeks before they could go back to work?
Now with robotic surgery, they're in the hospital 1 night. Most are able to drive, run errands at 1 week. Office type work, maybe back in 2 weeks. So we said we can do better, and the people at Intuitive Surgical have now come out with a single site platform to do hysterectomy. So we still use the platform that we have, but now all the arms come together to allow us to operate with new instruments through 1 incision in the umbilicus. Instead of the 3, we're down to 1.
Oh, so you're down to 1 now.
Just 1 incision. Again, quicker return to work, less bleeding, minimally invasive, much more cosmetic.
Now, usually I know you used to have like a operating room full of people here, and I'm sure with this, not necessarily so many.
We still have our same team. We value our team here. They do good work. But this is more just for the cosmetics and the quicker recovery for the patient.
Do you find that this is a lot less having any post-surgery problems, complications with the surgery with this than you did the usual way?
That's a good question. I think there's definitely less pain because there's fewer incisions, less chance of bruising and scarring.
Now, how long have you been using this? And I'm sure you wish this had come along
a
long time ago.
It just got approved in January, so we've been just doing this in the last couple of months. But we've already done some cases. Dr. Delgado and I do them together. And whenever possible, patients who have less invasive pathology, different procedures, we'll try to do single site now.
Now, pretty much this would be good for anyone? I mean, could there be some cases where you might have to do something different?
Good question. Complex cases, bigger uteruses, more bulky tumors will probably still need the traditional 3-site, but it's still avoiding an incision. It's still minimally invasive.
Well, thank you so much for
coming
sharing this. Now we're going to talk to Dr. Delgado and find out some of the other surgeries that they're doing here with this amazing Da Vinci unit at Singing River Hospital. Now, Dr. Delgado, you and Dr. Bosco were 2 of the first surgeons that were, trained in robotic surgery here on the Gulf Coast. Besides hysterectomies, what other types of procedures do you do?
Well, not only do we do hysterectomies with the Da Vinci system, but we're able to do complex gynecological surgery, which includes things like endometriosis, which is very prevalent. We can do ovarian cysts, removal of tubes, ovaries, not just hysterectomy. We're also very excited about the ability to do bladder control surgery using the robotics.
And do you see a lot of that?
Actually, more than you would imagine. I can tell you that the majority of patients, after having gone through childbirth or just natural course of life,
you find it in older patients.
Mostly older patients have problems with bladder control, but you can see it in a 25-year-old.
Really?
You can see it in a 30-year-old. And we're very proud that we're able to fix it nowadays using minimally invasive Da Vinci procedure and actually get them back to work, get them back functioning very, very quickly without the use of any grafts, any type of mesh. So there's no concern about those having any complications in the future.
Because you see the commercials on TV all the time, you know, did you use you have a surgery, did I use the vaginal mesh and all this stuff? This unit here actually pretty much alleviates the having to use any of that.
When we use the robotic Da Vinci procedure to do the birch or the bladder control surgery, we do not use any type of mesh, no mesh at all.
And that I'm sure that makes the patient feel a lot more comfortable as well.
Absolutely. You know, patients nowadays, when they come, when they're losing urine, just having bladder control problems, first thing they tell you when they come in the office, I don't want that mesh. And we can always reassure them that we don't use any mesh at all.
Yeah, because that's a lot, like I said, a lot of.
Oh, it
you
is.
see the commercials on TV.
It
with all
is.
the lawyers.
And even though it's still a safe procedure,
Sure.
but now we have an even safer procedure
procedure
that we can use, which brings patients just, you know, this calmness. It brings them knowing that they don't have to worry about it in the future.
Well, I know we got about a minute and a half left, but let me ask you this, just come on the guy's side.
Yes.
Are there any procedures or anything that this would be great for, you know, that they use this for men?
Yeah, actually they do. Here at Singing River Hospital, we have 3 service lines that use the Da Vinci machine. General surgery for gallbladders. We have the urologist using it for, you know, kidney removal, prostate cancer.
Oh, wonderful.
They do a great job. Also, we have the cardiothoracic surgeon doing lung procedures, cardiac procedures. So, you know, we are top of the line here when it comes the usage of the Da Vinci machine.
And that's one of the great things. We've been here in the past talking with some of the other doctors about the different procedures that they do use with the Da Vinci unit. So I mean, I know that y'all are so happy that you have this new technology, and it makes it a lot easier, and I'm sure a lot of the patients are as happy as well. Well, they're paging them already.
Sorry.
We're gonna have to go. Anyway, thank you so much
Thank you
being
for
with us.
coming.
And
I
thanks,
appreciate it.
Thank you so much for you know, educating us with this. So, you know, of course, if you think you might need some surgery, you always got to check with your general physician first, and then they will, of course, refer you to one of the surgeons here. They're a great team of people, great unit. It's the Da Vinci unit, and they've got it here at Singing River Hospital in Pascagoula. And thank you again to you and Dr.
Thank you very
Bosco
much.
for sharing all this great information for us
Appreciate
today.
it. Thank you,
It's
sir.
very, very educational. Very cool.
Thank you.
Thank you.
Thank you.